Queen Mary cruise liner. This is a cruise liner that came from Australia, left Australia on the 16th of March, was coming here with about 1,226 people on board, and it was in a leisure cruise liner, and on its way, as it was coming over to this side, of course, we then started having the emergency regulations, and it was amongst those that had to be asked not to disembark, and it was not therefore allowed to come in without very strict regulations. It docked in on Friday and asked for permission to disembark. Unfortunately, there had to be a lot of questions asked about the health of the the passengers and the crew and so on, and it turned out that there were a number of people who had symptoms which were suspicious of the coronavirus, and so the ship was then asked to wait outside the perimeter of the port, and in the process a lot of work had to be done to check the crew, to check the passengers, those who had shown symptoms. All in all, 26 passengers were checked, and they were tested, and they had to wait aboard for the results to come back. And in the process, it was found that all of them were negative, although initially there was a suspicion that there could have been someone who was positive for coronavirus. So that actually has been confirmed that they didn't have. But amongst those who were in the 1,226 people were 6 South Africans. So they were therefore informed that the rest of the passengers could not be allowed to disembark, but only the 6 had to be allowed out, and that the whole ship had to be assisted with on a humanitarian basis, so that it gets its food supplies and so on. So that has now been done in the past. I think from yesterday, my colleague, the Minister Balula, has been processing the authority for the ship to dock, and then of course the Department of Health has gone through, tested the individuals. They've been tested now twice, and they've been brought out. You would have noticed that when they were disembarking, one of them is from Gauteng, the other 2 are from KZN, 2 are from Western Cape, 1 is from the Eastern Cape. So they will be brought in now. They will therefore be asked to stay in quarantine in line with our regulations. So they will not be going home. So we'll have arranged for them to be quarantined. But the ship will now set off, sail back to where it had come from, to Australia. We just want to indicate that the condition of all those on board is healthy. Everyone is well. There is a doctor on board, and so we are quite satisfied that all the people who are in there, they don't need any emergency attention from our side. So because of that, therefore, because of the fact that we've got a restriction on ports not allowing any inbound ships and aircrafts, that's what really has happened in this case. We want to thank the port manager, the port health, and all the staff for managing the situation. We also want to thank the captain and the crew and all the passengers for understanding that we are really battling a difficult situation of the coronavirus, and every country has put particular regulations to make sure that we prioritize the health of our own people. So that is one of the issues why they are here, why we are here. We may just mention as well that we had previously received reports of 2 confirmed cases from another MSC cruise. That was a while back. One was around the ship that set off on the 28th of February and came back on the 2nd of March. We've got a patient in the Free State who turned out positive after disembarking from that cruise liner. The other one landed on the 16th, was on the 13th to the 16th of March, then also turned positive when the ship had gone to the Portuguese island. And so we were looking at that those particular passengers. So we've asked the port manager and the owner of the cruise liners to help us to get us more information, just to be sure that we have tracked everyone who was part of that. We do understand that it looks like it's a bit of a while since they had actually disembarked, but nevertheless we think it's important for us to just have a sense of the whereabouts, just to be able to make sure that we can track all the individuals if in case they did experience symptoms in the process. It's important for us just to close that whole chapter appropriately. So we just want to therefore say to those who might have been part of these cruises that they need to be aware that there were people in those particular cruise liners who were positive, so they need to approach the medical doctors or the government public facilities to be able to be screened properly. So we just want to get a history, what has happened, if they had symptoms and so on, in case there's anyone that we missed. So that's been important. We've been in touch with the managers of the MSC operations. Again, they are prepared to cooperate with us. We just need to make sure that everyone is aware that there is this particular issue that we are dealing with. Having said so, I'd like to then also update fellow South Africans that at this stage we have confirmed COVID-19 cases standing at 1,353, which is an increase of about 46 from the last reported. President did indicate the figure when he spoke to the nation yesterday. So the figure has gone up by 46. Just to also indicate that the total number of tests that have been conducted to date is about 39,500. That is the number of patients tested, but number of tests is close to 42,000, which means there were other repeat tests that have been done in addition to those. Just as a matter of a breakdown, this gives us 633 in Gauteng, which is the highest, then 325 in the Western Cape, and then KwaZulu-Natal 179, and the Free State 74, and then in the Northwest 8, Mpumalanga 12, Limpopo 14, and then Eastern Cape 12, and Northern Cape 6. Then we have still got unallocated, which is 90. Now, this unallocated basically means that with the pressure of the numbers of patients that get tested, we sometimes don't get all the information that we need. I've issued letters now to all the laboratory CEOs to say it's obligatory that all those forms need to be filled. And that information is important because unallocated means a delay in us finding out the identity of the patient, also the contact details, as well as the contacts that need to be followed up afterwards. And yet, the sooner we get that information, the better for us. It's important for us to be able to get that information as soon as possible. This is something that we hope to resolve in the future, because we are updating a lot of our systems to be able to ensure that there is technology that's helping us in even recording some of the people that we get, and also to make sure that you can go immediately to where there's incomplete information. As the form is filled, we actually find out that this one is incomplete and we go to the doctor quickly. So that we will be dealing with fairly soon. So I hope that we'll be able to clear this one in particular. I may as well also just indicate that these numbers that you are seeing mean that there's been a huge pressure on our laboratory services to report, to test all these specimens. So last week, around Thursday, we started picking up a problem in the system that there were backlogs that we're experiencing. As we checked through the system, we realized that some of the pressure on numbers meant that some of the laboratories were not coping with the specimen that they had. We went through, and this particular laboratory that had the largest numbers disclosed the numbers, and then we actually moved a lot of them and got them to the National Health Laboratory Services so as to even the pressure. So ultimately we cleared that. By Friday we had about 4,000, which we cleared by the end of the day. So what I very much want to commend is the cooperation amongst the various laboratories, that they are able to tell us if there's a challenge, and that also they are able to cooperate to be able to resolve the problem. So in this case, we were able to get all the specimens cleared. Now we're watching quite tightly on the system to see that there's no backlog, so that the numbers of tests that are reported must reflect the numbers of specimens that have been taken. We want to make sure that there's no lag in there, because part of the problem has been that sometimes someone gets a test done, but because of the logistics of transporting the specimen, it takes a while to get the responses back. It no longer takes a long time to finish the test, so we want to make sure that we get as close to giving the public live data as possible. So having said so, we've also noticed a very interesting trend in the past week up to date, because the the rate of increase of the numbers is not as much as we initially anticipated, which we believe that our modeling, which we have done for the next 3 weeks, we have already showing that we are falling a little behind the figure that we thought we might be reaching this month. It's still too early to say, but I'm just saying that we're just observing that trend. The figures that we thought might be possible by end of, let's say, by the 2nd of April, we could have been anywhere around 4,000 or 5,000, but we think that we may not be able to get there. We think that also for the following week, we're watching those numbers. We may not be going as high as the numbers that were anticipated. As I said, that is still too early to say, but I think that the number of factors that we are going to look into that might be responsible for that. The first one, I think, is the fact that we closed the ports of entry. The airports, the seaports, a large number of our positive patients had actually come from people who are returning into South Africa, or those who are coming as tourists from some of the countries that are really at the epicenter of the infection. We think that the fact that we don't have that large number, because up to last Thursday, Friday, 70% of the positive patients were actually coming from those from that kind of history. Of course, we have now started picking up internal spread, which is a matter of concern. I think there's been a lot said now about a patient in Khayelitsha, a patient in Alexandra, a patient in Soweto, a patient in Guamashu. This is the area that we have been really very concerned about, that we need to make sure we act quite swiftly to reduce the internal spread, internal transmission. So what we are therefore going to be doing, we're going to be picking up, escalating the testing and screening of the patients. So why I came to visit the province was to be able to see how they're approaching this matter. And I must say that having had the discussion with the Premier and the MEC, and have visited the war room, I'm very happy that KwaZulu-Natal, they are all actually on their course to take the process forward. The approach we're going to be taking is that we're going to be unveiling in the next 3 days additional mobile testing vans, which will be deployed to a number of provinces, particularly with the ones where the problem is biggest, that is Western Cape, Gauteng, KwaZulu-Natal and Free State. And so there will be some sent to KwaZulu-Natal. The approach we are taking, as President has indicated, we are going to be increasing the numbers of field workers who are going to be doing the testing and tracing. Now, the tracing teams, as of last Friday, were close to just about 5,000 of them, and this number is going to be increased, possibly more than double it, as we use more of the community health workers, nurses, and some of the NGOs. We are going to be converting a number of the teams that were working on the PEPFAR-funded NGOs to actually come and give support at this level. A number of NGOs will be working with us in strengthening the support on the increasing the testing. The numbers of testing vans are also going to be increased, and we're going to be using largely at this moment, we're focusing on the PCR testing, which is what we currently are using. So I think the most important aspect thereof is that as we move, we have decided we're going to be very targeted. For a start, we go to what we call hotspots. We go for every patient who's positive. They are plotted on a map. We're now going to target the areas where they've been identified, and then go into those areas, look for people who have got symptoms and deal with them, and therefore triage them so that we know which ones need to be treated, which ones need to be tested, and which ones need to be referred to hospital for care, and who needs to be taken for quarantine. So that is what's going to be happening now. In other words, we're actually scaling up the intervention. If I were to put it the other way, when I said some time back we were, excuse me, when I said the other time that is a combat zone, effectively what we've been doing has been a very defensive or reactive approach, where someone gets attacked by the coronavirus and then they report, then we go test them. Now we want to be able to go out to areas where we suspect that coronavirus could be now have to be spreading, and therefore we'll target those areas, and then we'll get people to go and start testing in those particular areas. So I think it's important for our people to know we won't be going to all the townships every at the same time, but we're targeting those where we want to deal with the already identified cases of positive people or contacts. Already this morning, the Gauteng government had gone all out to Alexandra. They've started the program. I'll be visiting Free State on Thursday. Again, they've also set up their mobile teams on the ground. They'll be moving out. On Friday, I'll be visiting Western Cape. We'll also be rolling this whole issue out. So effectively, we're actually getting our ground operations up and running, and we're scaling up the offensive. And in this case, we want to make sure that we can test people on the ground. This week, we are focusing on using the same PCR test that we're doing. But behind the scenes, we are actually focusing on looking at changing the strategy to look at additional means of testing. So the South African Health Products Regulatory Authority, SAPRA, and the Ministerial Advisory Committee are working on 24-hour basis to identify the kind of rapid tests that we are going to be able to use, because whilst they have not been registered through WHO, many countries have already started registering them and are utilizing them. So they are working flat out to be able to identify those, so that we'll then add those as an additional approach towards widening up and scaling up the testing process. So that is how we're going to be actually dealing with this issue. So from now on, we will be seeing mobile teams that are going to be located in various townships, and as we get more and more of our mobile vans into commission, they'll actually be getting onto the various areas that we will have targeted. It's important for us to do this because, as we have said, we want to get ahead of the curve. Most of the patients that we have are actually recovering well. We reported last time that we have about 31 of them were recorded as having recovered. The number we're quantifying right now is actually growing quite well. We don't have the total figure just now. We'll report that in the next stage.